screen share view. All right, so today we're going to be talking about an article that was posted for you on iEcho yesterday called Caring for the Caregiver in Dementia. I labeled this as a journal club / article review. It's really more of an article review, but I'm very curious to hear all of your experiences and input on this topic. And I lost my mouse. There it is. So I already mentioned the title of our article is Caring for the Caregiver in Dementia. This was published in the Journal of Family Practice last summer, and the reference is there. The article actually begins with a case, and I've summarized the case here. Again, you can read the full case in your or in the article that was posted for you. So it began with the case of Sam. Sam is a 68-year-old man, and he presents to his family physician who practices in a rural health clinic. He complains of weight loss. He's lost 20 pounds in the last 8 months. He is irritable, and he has difficulty sleeping and concentrating. His review of systems is otherwise negative. His past medical history is not remarkable. He had previously only presented to the clinic for his annual exams and never really had any specific complaints, and he does not take any regular medications. Sam moved to this area several years ago. At that time, his parents were in their mid-80s, and he wanted to be closer to them. His mother has since passed away. She died from acute leukemia. His father is now in his early 90s. Sam lives next door to his father, and his father has been needing increasing assistance with both his activities of daily living and his IADLs. He has been diagnosed with arthritis, vascular dementia, neurogenic bladder, and ataxia, and his father remains very hesitant to give up his independence. In your office or in the provider's office, Sam takes a PHQ-9, and his score indicates that he has moderately severe depression, and he verbalizes strain related to his role as a caregiver. So we'll circle back to Sam's situation a little bit later in the discussion, but just kind of having his presentation in mind as we're talking through the rest of the article. Some background. These numbers are pretty staggering. Over 11 million people provided more than 18 billion with a B, hours of unpaid care for individuals living with dementia in 2022. So that's not caregivers in total. That's caregivers just caring for individuals who have dementia, 18 billion hours of unpaid care. When you average that out, it's about 30 hours of care per caregiver each week. So it's basically like having a full-time job. Most assistance with ADLs and IADLs is performed by informal caregivers, so family, friends, other loved ones. And this article defined caregiver burden as strain or load borne by a person who cares for a chronically ill, disabled, or elderly family member. I would add that it doesn't necessarily have to be a family member. It could be a friend or other loved one as well. It has been found that individuals caring for a loved one with dementia actually have a higher level of caregiver burden compared to individuals who are providing care for recipients who have another diagnosis, a non-dementia diagnosis. This burden has also been found to be higher when the care recipient has behavioral and psychological symptoms of their dementia. And this is not consequence-free for the caregivers. So these are some of the health outcomes that have been associated with caregiving for an individual with dementia. You can see there on the left side, they discuss physical outcomes, so poor self-reported health, increased use of healthcare for the individual who is providing care services, more prescribed medications for those individuals, hypertension, changes in their physiologic biomarkers of stress. And interestingly, for the caregiver, there has also been a noted decrease in cognitive function. Also psychological outcomes, depression, as our patient presented with, anxiety, burnout, loneliness, reduced quality of life, and sleep issues. There are other health conditions that have been reported by dementia caregivers. Again, anxiety and depression kind of topping the list, obesity, cancer, diabetes, heart disease, and stroke. This caregiver strain also has potential negative outcomes for the care recipient. It's been found that individuals who are cared for by folks who are experiencing a great deal of caregiver burden are institutionalized earlier, they are hospitalized more often, they actually display more of those behavioral and psychological symptoms of their disease, they can have a reduced quality of life, and there can be an increased risk of elder abuse. So these are big issues for both the caregiver and the care recipient. And it can lead to clinicians feeling kind of helpless. What do we do? How can we help these folks? So per this article, their biggest recommendation was assess often, assess early. And they recommended ideally assessing both the caregiver and the recipient, and if possible, assessing them together and separately. They advocated for asking the caregiver about their relationship with the care recipient, so the context of that relationship, the quality of that relationship, their perception of the care recipient's health and functional status, their values as a caregiver, their well-being as a caregiver, their skills, abilities, and knowledge, what they perceive as being positive and negative aspects of their caregiving role, and assessing what their needs are. So do they need information? Do they need support when it comes to emotional issues, physical issues, or social issues? They also discussed several assessment tools that are available. One of them is called the Zarit Burden interview. There are 3 versions of the Zarit Burden interview that I came across. The one that you see here on the screen is actually the short screen. It's a 4-item screen. There's a sort of a medium length version that I believe was around 12 items, and then the full length version I believe is 22 or 24 items. So this is the briefest version that assesses on a never to nearly always scale. And the questions that it asks are, do you feel that because of your relative that you don't have enough time for yourself? Do you feel stressed between caring for your relative and trying to meet other responsibilities? Do you feel strained when you are around your relative? And do you feel uncertain about what to do about your relative? So that is one assessment tool that is available and brief. They also mentioned in the article that there is a need to continually reassess as caregiver needs are inevitably going to change over time. So early on, or when a diagnosis is first made in a patient with dementia, the caregiver may need information about the disease and the expected progression of the disease. They may need information about care planning, navigating the healthcare system, which, as we all know, is quite complicated, financial planning, and emotional support. As dementia progresses, the caregiver is likely to need more assistance in managing the care recipient's ADLs and IADLs, any behavioral concerns that may arise, meeting social needs, both theirs and the care recipients, and emotional support as the relationship and the dynamic of the relationship inevitably changes between the caregiver and the care recipient. And then in late stages of dementia, the caregiver may need assistance with navigating placement in a care facility or making the decision to continue care at home. They may need assistance around end-of-life planning and anticipatory grief. They also mentioned in the article that it's important to be aware of specific needs that certain caregiver populations might have. For example, members of the LGBTQ community, those who are underrepresented minorities, and those who are providing care for individuals who have early onset dementia. Some potential resources that they mentioned you may be able to refer caregivers to included support groups, counselors or therapists, financial planners, legal services, home care agencies, or other formal caregiving services, be those day programs or more residential facilities, mind-body therapies, and online resources. So going back to the case of Sam, the article kind of followed up by discussing what his care providers did. They prescribed him mirtazapine with the goal of improving both his appetite and hopefully his mood. They connected him with home health services for his father, including physical therapy. Sam chose to hire some part-time private caregivers to assist with ADLs and IADLs. He did not wish to attend a local caregiver support group at that time, but he did request assistance with advanced directives for his father and wanted to engage around discussions related to driving. As I mentioned, his father had been hesitant to give up his independence, and he obviously felt that driving was a part of that. And the care team planned to engage in ongoing assessment and supportive counseling with Sam as his father's disease progressed. So I'm curious, and I want to open it up to discussion around whether the strategies that were outlined in the article you feel are useful or practical based on your experiences, be those personal or professional experiences, And again, perhaps thinking about what's worked for you in these types of situations, either in your practice or your personal experience, and where have there continued to be struggles. I've included the references at the end, really just the article that this information came from and that Zaret Burden interview. And I will stop my share so that I can see all of you and we can chat.